Diabetes prevention and management for seniors. For a healthy later life. Hello, dear seniors. Today I'd like to talk to you about a topic that is essential for a healthy and fulfilling life in your golden years. Diabetes prevention and management. Diabetes can affect anyone but middle-aged and older. Adults need to be especially careful. In this video, I'll share practical tips you can apply right away in your daily life. Why diabetes occurs, how to prevent it, and how to manage it step by step. Let's spend the next 10 minutes together learning how to stay healthy as we age. If you find this video helpful, please like and subscribe. What is diabetes? When we eat, the carbohydrates in food are broken down into glucose, a form of sugar that becomes a key energy source for our body. For glucose to enter our cells and be used as energy, it needs help from a hormone called insulin. Think of insulin as a key that unlocks the doors of our cells, so glucose can enter. But if insulin doesn't work properly, or there isn't enough of it, glucose builds up in the bloodstream. This is what we call diabetes. People over 60 are especially prone to type 2 diabetes. As we age, our cells become less responsive to insulin, and the pancreas gradually produces less insulin. What makes diabetes dangerous is the risk of complications. But don't worry. With early diagnosis and proper management, it is entirely possible to live a healthy life. So when should you suspect diabetes? Be mindful of these symptoms. Frequent thirst, frequent urination, constant fatigue, blurred vision, slow healing wounds, tingling or numbness in hands and feet. If you often experience these symptoms, visit a doctor for a blood sugar test. Why risk factors and early detection matter. Diabetes can be prevented or its progression delayed through early detection and consistent management. If you have any of the following risk factors, regular checkups are essential. 1. Family history of diabetes genetics can play a role. 2. Abdominal obesity, waist circumference, over 90 cm for men and 85 cm for women signals increased risk. 3. High blood pressure or high cholesterol, often associated with diabetes. 4. Lack of exercise and irregular eating habits. 5. Age from age 45. Checkups are recommended every 3 years after 65, every year. Here are the general diagnostic criteria. Fasting blood sugar level 126 mmol/DLE, HbA1c, A1c level 6.5%. A fasting blood sugar between 100 and 125 mmol is considered pre-diabetes, and this is the time to take action through better diet and exercise. Many people wonder, I don't eat sweets, so why do I have diabetes? The truth is, diabetes isn't caused by sugar alone. Excessive carbohydrate intake, lack of exercise, poor sleep, and chronic stress are all contributing factors. 3 key habits to prevent diabetes. 1. Weight management. Losing just 5–10% of your body weight can significantly lower the risk of developing diabetes. For example, if you weigh 70 kg, losing just 3.57 kg can have a big impact. The goal isn't rapid weight loss, but consistent, sustainable progress. 2. Regular exercise. Try to get at least 150 minutes of moderate aerobic exercise per week. That's just 30 minutes a day, 5 days a week. Activities like brisk walking, cycling, swimming, stair climbing, and even household chores are great options. Also add strength training 23 times a week to improve insulin sensitivity. You can start with simple exercises using light dumbbells or body weight. 3. Healthy eating habits. Choose whole grains like brown rice, whole wheat bread, and oats instead of refined carbohydrates. Eat plenty of vegetables with every meal. Choose lean protein sources such as tofu, fish, and skinless chicken breast. Fatty fish like mackerel and salmon are rich in omega-3 fatty acids, which help regulate blood sugar. Avoid overly salty or sweet foods and take your time to chew thoroughly. Daily habits that make a difference. Diabetes requires lifelong care, but small changes in your daily routine can greatly improve blood sugar control. Check your blood sugar on an empty stomach and 2 hours after meals. Learn how to use a glucose meter and track your results daily. Eat 3 balanced meals per day at regular times. Avoid late-night snacks and reduce unnecessary snacking. Stress is another factor that can raise blood sugar. Try meditation, deep breathing, walking, hobbies, or chatting with friends to manage stress. Sleep is just as important, and for 78 hours of quality sleep each night. Try to go to bed and wake up at consistent times. Quitting smoking and limiting alcohol are also essential. Smoking damages blood vessels, and drinking makes it harder to manage blood sugar. Foot care is especially important for seniors. Check your feet daily, treat any cuts immediately, trim toenails carefully, and wear comfortable shoes. Make sure to get annual eye and dental checkups, as diabetes can affect your eyes and gums. Medication and working with healthcare providers. Even with lifestyle improvements, medication may be necessary to keep blood sugar in check. This is not a sign of failure, but a tailored response to your health needs. One of the most commonly prescribed medications is metformin, which helps reduce glucose production in the liver and improves insulin sensitivity. Newer medications with fewer side effects and better efficacy are also available. What's most important is maintaining open communication with your healthcare provider. If you notice any side effects or changes while on medication, talk to your doctor right away. Never stop or adjust your medication without consulting a professional. Regular checkups and tracking your HbA1c levels help you and your doctor set and reach target goals together. Start today. Diabetes isn't just a disease, it's part of a lifestyle that requires long-term care. But even small habits can protect your future health. Start with something simple today. Take the stairs instead of the elevator. Eat more slowly and mindfully. Record your blood sugar on your smartphone. We truly support your journey toward a healthier senior life. If you have any concerns, don't hesitate to speak with your doctor. Thank you for watching.